Welcome back to the Armor Men's Health Hour with Dr. Mystery and Donna Lee.
Hello and welcome to the Armor Men's Health Hour. I'm Dr. Mystery, your host, here as always with my incredibly well-heeled co-host, Donna Lee.
For those of you who don't know, every segment is a mystery as to what you're going to say about me.
I really do have to kind of think about it.
I don't know what that one meant.
I'm like that little Simpsons chalkboard. I'm always trying to think about what I'm going to say next.
I liked it when I was lovely and ebullient. Can I go back to that?
I can't spell the word anymore. I think I made it up.
Google.
I'm a board-certified urologist, and this is a men's health show. This show is brought to you by my urology practice, founded in 2007, NAU Urology Specialist. But, it's not fair to say that it's my practice.
It's my practice.
It's a big practice now. We have
practice.
4 physicians,
We have partners,
5 nurse practitioner and PAs, 2 pelvic floor physical therapists. We do nutrition counseling with an amazing functionally trained physician assistant named Shefali Ravula. We have 2
Sex
pelvic
therapy.
floor physical therapists. We have sex therapy in the office. We do sleep apnea testing. It's unrecognizable as a urology practice. It is a men's health mecca.
Somehow, though, we're still the second largest urology group, and you know what that means.
We just try a little harder.
And we're prettier on the weekends
prettier
with
on the
our
weekends.
higher set boobs. Okay.
Well, sometimes you got to bring the milkshake to the bar, they say.
I think it's to the yard. Is it the bar?
So you know what? You know what's given me a lot of confidence in putting together a practice that does things in a relatively non-traditional way? It's having mentors and examples in the community. And today, we get to have one of my favorite examples on the show today.
The best.
The best.
That's right.
Dr. Billy Franklin,
Welcome.
founder of Victory Medical Center. Thank you so much for joining us today.
Oh, it's my pleasure.
So when we talk about primary care destinations for your care, oftentimes on this show we talk about how important it is that you take control of your health care. You make sure that you know and you trust your doctor. We love those doctors that try concierge care or MDVIP or different programs like that give patients the control, beyond their insurance. But you've taken the idea of primary care medicine and really expanded upon it. I'd love for you to share some of kind of how you founded the practice and how you started adding all the different service lines that you offer.
Well, that's a story. When I first started, I was a family physician, and our training in family medicine is really to treat the whole person. It's not so much give medicine, treat conditions. It's intrinsically treat the person, have a relationship with the patient. Sadly, that sort of dissipated over time, but having a relationship with the patient is an important part of medicine, and treating the whole person is a critical part of medicine. When you chop it up into different parts and when you give different medications, when you bring in a million different specialties, you've lost the ability. You can't treat the whole person. It's not an integrated process anymore.
It's such a great point you're making. Patients now naturally feel that they should immediately go to a specialist to get care for a particular problem. And without a quarterback, without a medical home, that care can be so disjointed that people can often end up on multiple medications that can interact with one another and not necessarily be getting the best, most efficient care.
That's absolutely true. We tend to want to split up the body into different parts. There's your stomach that needs to be treated, or there's your brain, or there's your heart. In allopathic medicine, the medicine we have now runs in that direction specifically. And we're trained individually to do different things. Family medicine is a more general thing, which really mimics the human body itself. The human body itself is completely integrated organ to organ. The heart speaks to the brain. The stomach is part of your immunity. There is no separation whatsoever.
Your penis is part of your heart and your brain.
We covered that earlier with Dr.
Really,
Picard.
I'm telling you, it really is a very important part.
Well, you laugh, but that's true.
Yes.
Every part connected intimately to the other parts. And I think we need to look at it that more often and with respect to that. And I think hopefully research will do that. I think the health insurance climate and some of the politics have unfortunately suppressed the ability to sort of nurture a whole person kind of treatment plan, unfortunately. When I started, my fantasy was I would teach people to exercise and they would eat right and would provide therapy and we'd provide some sort of spirituality and we'd cure everyone. Everyone would be perfect because they'd get every element of health. So that's where I kind of started. And we had a gym, and my ex-wife was a psychiatrist who ran groups. We had a sort of Indian person, meaning American native Indian.
That's right, because I'm Indian, and I'm confused now,
Sorry.
because you have lots of Indians now.
American Indian.
American Indian. Not.
We got to stay politically correct, though. We can't say Redskins.
No, you cannot say. What's
I
wrong
just
with
said
you?
that. You
We're gonna
can't
get
say it.
bleeped out.
Didn't I say that?
Oh
You just
my
can't say
lord,
that.
we just
Anyway,
got boycotted by
you had
Nike.
the Indians.
Which is kind of funny because really I'm more inclined to be more like a Dalai Lama spiritual person than necessarily a American native. But that's what we had at the time. Unfortunately, we weren't able to monetize those things. We couldn't really make a living having the gym and teaching sports and teaching nutrition. There was no way to get paid to do that. And so we had to sort of devolve into some other services that are closely related to family medicine, but that could potentially be paid in the normal system. So we started things like minor emergency clinic. We started sports medicine clinic, which then became physical therapy and chiropractic, and then massage therapy. Just kept evolving from there.
I mean, just the idea that you would have a sports therapy and massage clinic as part of a primary care office is really quite progressive. I mean, if you look today, many primary care doctors' offices are struggling because it is very tough to maintain overhead. It's a treadmill of seeing patients constantly. It's a really, like, you would look at that job and say, I wouldn't want that job because it's really, really, really hard work with so little appreciation. But
And insurance is going down
yeah,
every year.
reimbursements are going
I don't
down
think
and
people know
costs
that.
are going up. And what you've done with your practice is really make it a place that I would be like, well, I think I wouldn't mind working there. Those guys look like they're having a good time. They offer so many service lines. You have advanced cardiac physicals. You have massage therapy. You, of course, have an aesthetics program here. What are some other service lines or products that you are particularly proud of?
I like our allergy program. It's a progressive program. It does involve what's called desensitization, which is sort of a standard allergy program where people get exposed to whatever they're allergic to and slowly desensitize over time, which can involve oral medications or injections. But the standard way to do that takes a few years to develop, or even, maybe even a year. We have this sort of high-power version of it where we load people up with antigens or allergens. And now this is riskier because people do have allergic reactions, possibly life-threatening ones, but we're there, we control it. What we do by that is we make them non-allergic rapidly. A couple months, allergies are gone, rather than the usual long, trudging, weak shot program. So we have a pretty sophisticated allergy program. And allergy, of course, is a huge thing in Austin. When you're talking about the sports medicine, it's unfortunate that there's not more sports medicine in primary care. When I trained as a family physician, we didn't have any sports medicine, even though that's about 40% of our practice once we get into real life.
That's funny.
People come in, they get hurt, they get injured. It's a huge part of practice, but we don't actually get any training in it, which is weird. But it's a very important part of what we do. It's intimate to what we do. People hurt themselves and their joints and things like that.
And so as you look to the future of medicine in general and how primary care is going to evolve, what are some ways that you see it's going to evolve in good ways and bad ways?
Well, I think that we're moving toward telemedicine. The web is sort of affecting all industry. And so we are doing a lot more telemedicine. The advantage of that is it creates a much more accessible form of care for a lot of people. The disadvantage is that I think people sometimes are overconfident about what can be accomplished via the internet. Like,
I agree.
We can't find a diseased liver over the internet. We can't. Well, there's a lot of things we can't see. We can't do a heart valve over the internet. And there may be in the future tools that help us accomplish that.
With electronics and fancy kind of monitoring equipment. But really, I find that very few things truly can mimic the face-to-face interaction, the doctor's hands on you to give comfort and care that a face-to-face appointment does.
Well, I'm so glad to hear you say that because that goes back to a patient relationship. It's very important to have a relationship with a patient, and that's been sort of lost, particularly in things like telemedicine and in the insurance world. Thousands of different doctors that you're sent to people you don't know, and they confer with other people you don't know. In the old days, we would call up whoever we were sending the patient to, explain the story, then we'd talk about it later, what happened.
Now it's just a piece of paper with an unintelligible EMR record.
To an old school fax number.
to a fax number.
We're still faxing y'all in 2020.
Well, Dr. Franklin, I can't thank you enough for participating on this show. You really are somebody who I look up to, and your practice is something that I think is really amazing. If listeners out there want to become part of your ecosystem, how do they get a hold of you and make an appointment at Victory Medical Center?
We are at www.victorymed.com.
And your phone number, Donna, you know it by heart.
That's right. I intimately know 512-462-DOCS. That's 3627.
I wish you said our number with so much excitement.
You know, right?
Come
I'm
on.
like, our number's
Give it up.
512.
Give it up.
Okay.
Give it up.
Our number is 512-238-0762.
That's
better?
It's better than the
All
Lockhart
right.
accent I got earlier.
Thank you, Dr. Franklin.
Thank you, guys.
The Armor Men's Health Hour is brought to you by Urology Specialists. For questions or to schedule an appointment, please call 512-238-0762 or online at armormenshealth.com.